Bismillahirrahmanirrahim. Assalamu alaikum. I am Professor Dr. Javed Iqbal FAROOQI, and you are watching my YouTube channel Health Education. From today, we are starting our discussion on kidney stones. This discussion will have two sessions. Today, we shall have first session of our discussion on overview of kidney stones. Do you know that 1 in 10 people will have a kidney stone in their lifetime? And the pain, someone say it's worse than childbirth. Ever felt a sudden excruciating pain in your lower back that made you double over? You might have had a kidney stone without even knowing. Imagine waking up in the middle of the night with unbearable pain in your side. You rush to the ER only to hear the doctor say, you have a kidney stone. What happens next? Let's break it down. Drinking milk causes kidney stones. Is this true or just a myth? Today, we are separating fact from fiction about kidney stones. If you have ever had a kidney stone, you know how painful it is. But what if I told you there's a way to prevent them? Stay with me for the next few minutes and I shall show you how. I would like to share few real-world case histories of renal stones to make you understand this disease properly. First case history, the young office worker with sudden pain and no warning. It's a story of Ahmed, a 30-year-old software engineer. He was in the middle of an important meeting when he felt a sharp pain in his lower back. Within minutes, he was sweating and nauseous. Rushed to the ER, he was diagnosed with a 6-millimeter kidney stone. He later realized his high sodium, low water diet was the culprit. So the lesson we get from this case history is hydration and diet matter, even if you are young. Second case history is that of pregnant woman confused with labor pain. It's a case history of Sarah, 32 weeks pregnant, who woke up with severe abdominal pain, thinking it was early labor. She rushed to the hospital only to find out that she had a kidney stone. Since pregnancy limits painkiller options, she had to manage the pain naturally until she passed the stone. So the lesson learned from this case history is kidney stones can mimic labor pain. Pregnant women must stay extra hydrated. The third case history is that of a bodybuilder. Too much protein and too little water. This is a case history of Bilal, a 28-year-old fitness enthusiast. He was on a high protein diet to build muscles. He ignored mild discomfort for weeks until one day he collapsed from pain at the gym. A scan revealed multiple kidney stones, like due to excess protein and low fluid intake. So the lesson learned from this case history is too much protein without enough water can increase kidney stones risk. The fourth case history is a diabetic patient. Ignored the signs for too long. This is a case history of Mrs. Fatima, a 55-year-old diabetic. She had mild flank pain for months but ignored it. One day, she developed a fever and chills, signs of a kidney infection caused by a blocked stone. She needed emergency surgery to remove the stone and treat the infection. So the lesson learned from this case history is ignoring kidney stone symptoms can lead to serious complications. The fifth case history is that of a college student. Energy drinks and junk food disaster. It's a case history of Ali, a 22-year-old university student, relied on energy drinks and fast food to survive exam season. After weeks of discomfort, he ended up in the ER with a 7 mm kidney stone. Because excess caffeine, dehydration, and poor diet. Lesson learned from this case history is caffeine and processed food can contribute to kidney stones. So balance is the key. So dear viewers and colleagues, what we have learned today: first, stay hydrated. Water is your best defense against kidney stones. Second, watch your diet. Too much salt, protein, or processed food can increase your risk of kidney stones. Third, do not ignore the warning signs. Severe pain, nausea, or blood in urine means you should see a doctor as soon as possible. So if you found this helpful, share it with your friends and family. You might just save someone from unbearable pain. Imagine a world where no one has to suffer from kidney stones. A world where simple lifestyle changes, like drinking more water and eating healthier, prevent the pain before it starts. The world begins with you. So take the first step today. Grab a glass of water. Make smarter food choices. And listen to your body. And do not forget to subscribe for more health tips. Kidney stones can happen to anyone. But the good news is they are largely preventable. I have seen firsthand how small changes can make a big difference. Have you or someone you know ever had kidney stones? Share your experience in the comments below. Let's spread awareness and help others avoid this painful condition. Like, share, and follow for more healthier insights. See you in the next episode.